What are 3 common side effects from hormone replacement therapy and how do you fix them? Let's talk about it. Hormone replacement therapy can have side effects. Today we'll talk about the 3 most common side effects and how to fix each. The number 1 most common HRT symptom is breast tenderness. The reason for breast tenderness is twofold. When you take HRT, typically estrogen and progesterone, you're stimulating your breast, which is natural. That's what estrogen and progesterone do. But if you're taking too much, or if you're not metabolizing your estrogen appropriately, making more of the inflammatory types of estrogen rather than the non-inflammatory types, you're going to have more breast tenderness. Taking DIM and IC3 indole found in cruciferous vegetables can help metabolize estrogen to favor non-inflammatory 2-hydroxylestrone rather than 16-hydroxylestrone. I recommend 100 to 200 milligrams of DIM per day, up to 400 milligrams to treat breast tenderness. Now, sometimes DIM is not enough, and you also need to add some flax ligands and EPA from fish oils to improve your estrogen metabolism. In the worst case scenario, if your gut is out of balance and your microflora is producing too much beta-glucuronidase, which frees the steroid hormones that you should be defecating out, you will need to add some Gulcarate to your supplement regimen. Too much progesterone can also cause breast tenderness. Number 2 most common side effect of hormone replacement therapy is bloating and fluid retention. When you have too much estrogen on board compared to progesterone, you will retain water in your tissues that will make you feel bloated. Your fingers look like sausages, your feet and ankles are swollen. This is different than peripheral edema from poor circulation or cardiovascular issues. This is a kind of a full body fullness. The same supplements, DIM, flax ligands, and EPA, can help with the bloating from hormone replacement therapy. Also, lowering your hormone replacement therapy can help. The 3rd most common side effect of hormone replacement therapy is headaches. Hormonal headaches are partially due to increased blood flow to the brain and also due to some of the same issues that's causing bloating. These hormonal headaches can be tension headaches or migrainous headaches. Hormonally induced migraine headaches respond very well to sublingual B12. Taking B12 prophylactically, meaning every day, can help to prevent migraine headaches. And you can also take extra B12 when you're feeling headachy. Genesis Gold can help to optimize hypothalamic function and optimize hormone metabolism, so you do not have as many side effects with hormone replacement therapy. If you have any questions, please join us in our Hormone Reboot training. I'll see you in the next video.